everybody. Welcome to In the Know with Nina. I'm Dr. Nina Crowley, your host, and I'm so excited to be here today with Dr. Basma Faris. She is an OB-GYN and a culinary medicine specialist. She's also a registered dietitian, which I think is, a little club that I love to be part of. So I'm really excited to talk to her today about women's health, hormones, body composition, and kind of all the things. And we got to share a stage together at the big annual nutrition meeting, and it was fantastic. But I wanted to bring that to you all and just kind of dive a little bit deeper in this way. So thank you for joining me.
Thank you for having me. I'm so glad that we get to do this. I'm so glad we got to present together at Fancy. What a great experience that was, and I was so happy to reconnect with many RD friends, people, some that I've known for many years, some who I've just met, some who I've only met on the screen, right? And I got to meet them in real life, so it was really fantastic. So
It was great. And you guys did, you and Heather, Heather's a dietitian and a chef. And so it was really nice to bring sort of that angle to the stage. And you guys had the biggest room at the conference. You had like 3,500 people close to it, which is really cool.
honestly, I didn't even realize at the time it was such a big room. So I just focused on the two people that I knew that were up front, and I just kept looking at them, and I didn't look beyond it. And I'm glad I didn't, because I think I probably would have been a little bit intimidated by the large group. But I'm glad it was well received. I think they're important topics to talk about. We spoke about PCOS and the menopausal transition, and we definitely need more, we need to learn more about it. We need more research in both of those areas, but I'm glad that we were able to introduce what we know and what we don't know, and, best practices. So thank you
Yeah.
for, yeah.
Yeah. I love that approach. I think the way we did what we know and what we don't know is so critical, because these days, as we were talking, in the obesity space, in the women's health space, there's a lot of people claiming to know everything, and that you should do their thing and buy their program and buy this or that, supplement or program or anything in that category. And
Yeah.
so I think it's important for all of us who are kind of at that critical age also to be able to be well-informed consumers for ourselves, for our patients. And it's hard to do with the impact of social media and a lot of loud voices, right?
A lot of loud voices, and I think people aren't comfortable enough saying they don't know, or they say very strongly that they know something, or they make a recommendation that maybe they're not intending it to be for everybody, but when they're speaking, when they have a large platform, the listener, the watcher doesn't know, right? The end user, are they speaking to me? Are they speaking in broad strokes? Do they mean that for everybody? And the nuance gets lost, and I don't think enough people like own up to that. And I can think of many notable examples. I'm not going to call anybody out by name, but people who I do know and respect, who are very smart and good at what they do, but maybe they don't maybe know as much about nutrition, or they maybe don't understand the implication of their words when they do sort of make these sweeping generalizations. What then do people actually go out and do when they hear that? I think is probably underappreciated.
Yeah, and it's a space too where, very similar to weight health and nutrition, where the traditional model would be you go to your healthcare provider, you talk to them about your individual case, and you get personalized recommendations based on you and your story. But that doesn't seem to be the way people consume health information as much anymore, and it does get to be in that space where it's blurred lines a little bit. So
Yeah.
I think I love that you are combining all three of those areas: women's health, obesity care, nutrition, and maybe even more, where you can kind of bring that together, and even sharing where do we go for good information when it's not your one-on-one? How do you know what is a good healthcare provider? And we've had a lot of these conversations in talking about hormones and perimenopause and hormone replacement, blood work. What do you get checked? There's lots of people wanting to check lots of labs and prescribe lots of supplements. And
Mhm.
how do you know what's noise and what's real, it's tough.
It is tough. I mean, and there certainly are red flags that we can like think about and talk about. Some of them would be if somebody's saying everybody should be on something. I think that that is a red flag, right? Even if there is something out there that benefits most people, right? Or really doesn't have significant harm, it doesn't necessarily mean that that thing is what that person needs. And especially if it means they're not going to do something else that may be even more important for them, right? Because they're limited in their budget, they're limited in their resources. So if
Right.
somebody's, here is like everybody needs to be on this, and they're spending their their health and wellness budget on that thing, and they're not actually then getting what they personally need, right? Based on their personal circumstances. Or a medication, right? There are doctors out there that will say, like, everybody needs to be on hormone replacement therapy. Everybody needs to be on estrogen. Everybody needs to be on a GLP-1. I've been hearing that, right? That just, whether at a weight loss dose or a microdose and different terms that people use. I think that's also kind of worrisome to me, that everybody, right? Because you don't know that person's history, you don't know what's going on with them, you don't know what's going on with their gastrointestinal tract, what surgeries have they had, what do they have a history of disordered eating, like these are all the
Right.
important questions that anybody who is familiar with prescribing any of those treatments would know to ask. So when somebody of authority just goes out and says sort of everybody could benefit from something, that gives me pause, and to me that's a little bit of a red flag. Or when people emphasize sort of one particular nutrient, that concerns me. Um,
Hmm.
those are some of the messages that right? When the answer to everything is protein,
Yeah.
right?
We see
Which is
so much
fine
of that
because
lately.
many people, and it may be that person's particular niche, that
Hmm.
patient's, that person's patient population maybe is undernourishing on a particular nutrient like protein. But so many Americans are definitely not deficient in protein, right? We're we love meat in this country, and so when people have a platform and they don't understand all the people and the responsibility of the messages and all the people that they're speaking to, there is potential for harm. And so, those are the kind of the things that worry me. When people are selling you the test and the cure, that's a
Yes.
worry, right? Some of these panels of testing that you have to get directly from the provider, and from that professional, and your insurance doesn't cover it, and you have to pay out of pocket, and you have to get it from them, and then the results are pointing you towards particular set of supplements that also that person
Only
is
sold by
selling,
them. Yeah.
right? That's a red
Yeah.
flag because that's a conflict of interest. And so, those are some of the things that you want to be as a consumer of healthcare, as a patient, as a person, trying to navigate all of this. Those are some of the things that I think you want to um, watch out for.
Well, and as we're talking about, kind of perimenopause, menopause, that transitional time, um, the symptoms seem to be so. There's some of these subjective symptoms that are really tough to pin down, and a lot of times they overlap with other maybe health conditions. They overlap with obesity and some of the kind of
Yep.
ways that that presents. I think one of the areas that I hear a lot of people, of my age group talking about is, well, is this a symptom that I need to be getting treatment for? So maybe we could start there and
Yeah.
just, give us like in the broad strokes, knowing that the real individualized, personalized care approach means, have a trusted provider that can look at your whole picture and not, not make those all or nothing kind of claims. But what are some of those things that we need to start thinking about in
Yeah.
our early 40s, late 30s? What do we need to start thinking about? And then I also think it's important, where I heard you speak last year on this, sort of just the shift in thinking around hormone replacements. Like that was an area of science that almost sounds like, and you'll say this better than me, that was like buried for 20 years, right? And so it's like almost we're coming out of an awakening of people caring more about this, kind of like an obesity care where we have new medications that offer a lot of hope. So it's interesting to me that they're kind of coinciding.
Well, they're coinciding for people like us because these it's us and our peers, right? And so, but perimenopause is a time of, metabolic shifts, and so that's why there is a lot of overlap. But this is something that I want to say, that I don't want us to pathologize perimenopause and menopause, right? Um, we're not out there thinking that we're going to somehow, if we're thinking about adolescence, we're not going to miss puberty, right? It's going to be very obvious. And if somebody, unless they have, in very rare instances, all, children will go through puberty if they, reach adulthood. We're not going to miss perimenopause and menopause. So it's not necessarily something that we have to diagnose per se as if it's a medical condition. It's a life stage. Now, within that, there are symptoms that may be concerning, that may be a result of perimenopause, but also could be a result of something else. We don't want to miss those other things. So it is important to make sure that if somebody is having some new symptoms, that we're not missing a treatable medical condition, right? So we have to exclude those things before we can just say, oh, it's due to perimenopause. And now we can decide, is this a bothersome for you? And is it contributing to adverse health, right? So, sleep, I would say sleep disruptions being a big one. We know sleep disruptions can have negative health outcomes. So, if we've excluded other medical conditions, other sleep disturbances, sleep apnea, etc., we've excluded those conditions and we attribute it to perimenopause. Is it something that we need to address because it's negatively impacting your health? But if somebody is
I love
going
the frame on
along,
this though. This is really, I'm loving the way you're talking about this, because it's like, you do hear people talking about it like it's a problem that needs treatment, and for many people they don't ever
some
necessarily take
people have
hormones
a
or have
very
treatment.
smooth transition.
Yeah.
They have minimal complaints and they don't really feel that bad, or they're on a medication that is mitigating some of their symptoms. So, for example, I had a debate the other day with another professional about they gave the example of somebody who has PCOS who was using hormonal contraception to manage their PCOS symptoms, right? A very appropriate use. And they were suggesting that that person should come off of their contraception in order for us to understand whether or not that person is in perimenopause when they weren't having any symptoms per se. So why do you make people suffer, right? Why should we take somebody off of their hormonal therapy, which is treating a condition that they have, and maybe also treating their perimenopause, just to know, right? We're not going to miss it. What may end up happening is that person may find that the treatment that was working for them to manage their PCOS symptoms is no longer working for them because they are having some hormonal changes, because they have perimenopause. And now we have to look at what's a different option. Do we need to add something? Do we need to take something away? Do we need to adjust the dose or the formulation? But, this idea, we're not going to miss it. And so if somebody is missing it because they are feeling fine, like, that's so great.
That's a really good point.
So, that's what I mean by we shouldn't be pathologizing a life stage.
Yeah, and I mean, there's so many things where just the counseling is around normalizing and acceptance of things. So as you're saying that now, I feel like a lot of the messages that we see are pushing us towards, this is a problem that needs fixing and here's my solution to fix it. So yeah, that
Yeah.
definitely have your hairs up as red flags, for those type
So
of
that's
messages.
pathologizing so that we can monetize, right?
Totally.
Yeah. So that kind of stuff kind of bothers me. And I think, we see it in many spaces, and we see it in women's health. We see it in obesity medicine, right? Because if somebody, right, if we really truly are patient centered and individual centered, then we should be trying to figure out what their goals are, not what our goals are for them. And
100%.
so, I think the same thing goes for, people going through the perimenopausal transition. And we can't, decide for people what's important.
And we hear it, I mean, what I hear a lot of too, is kind of, it intersects with body composition is, you know, I've been able to sort of, in a definite air quotes here, control my weight for this whole period of time up until now. And now I'm doing the same things that I used to do, but my weight's creeping up. Or more often we hear it's, the body fat is distributing around the
Yeah.
midsection and people don't tend to like that. And so I
And that's
always do have
cool.
this sort of feeling of like, well, what is normal and okay and womanly and part of the process that we all are going through, and like what is actually okay. If someone's saying they don't like it, it's impacting their life, their quality of life, they're wanting
Yeah.
to change that sort of, that's that patient-centered piece of that equation.
Yeah. Yeah. Because some people just may say that that's part of, that's how all of my aunts and my mom look now, and it's okay, and that's just how we are, or it's really bothersome to me, or I'm concerned about the impact that it's having on my health, right?
Hmm.
So those are all different things, and there's room for all of it, but it's not for us to decide. And also this idea that we won't change and that we shouldn't change, um, also, I think is harmful, and also, um, that we're always going to have the same needs, because the needs that we had as an adolescent, the needs that we had when we were pregnant, right, were different. The needs that we had when if we were lactating are different. So like our needs are going to change in different times of our life. We have to learn how to adjust.
I
So
saw something just on my news feed this morning. It was like an old picture of Blanche from the Golden Girls, who I guess was in her 50s at
yeah,
the height of that, and then what she would look like now with like different hair and very voluptuous, and sort of like just the changes in how we've viewed, you know, women at that age,
yeah.
and that's within our lifetime.
I know. When I look, I'm like, no way, right? I'm like, there's absolutely no way that was the age that she was supposed to be. That was our perception of what it, of like just the fashion and the
Yeah,
everything, right?
yeah.
Yeah.
So when people come to you, sort of, what do you first start talking about? I mean, what's kind of the way that people present to you? Obviously, knowing everybody's got their own different story,
Yeah.
and what are some of the things that you guys talk about?
Yeah. Really like when I first meet somebody, whether, and a lot of times I'll do these sort of, free meet and greets, before people decide to work with me. Cause I think it's important that it's a good fit. Um, I'll have them, I'll start off by saying, share with me as much as you are comfortable sharing about what is bothering you and what it is you are trying to change, get help with. Because that allows me to then decide, am I a good fit for them? Am I going to
Mhm.
be able to help them in the way that they want to be helped? And so that's how I start off the conversations. And so I'll tell them, I'll let you start, and then afterwards I'll tell you what I offer, and whether or not that's a good fit. And I think that's a great way of setting expectations, because sometimes people want something that I really don't offer. And then I can let them know what I do offer and sort of what the process is, so they really have an understanding of what it means to work with me. And I think that's really important. And if it's not a right fit, it's not right. And so I'll say, hey, I can point you elsewhere if you'd like. I have colleagues that I can refer you to, because my process really is, using sort of all the tools in the toolbox, but I don't do a ton of testing. I review people's testing. I'll add if I feel like things are missing. I don't do any of these sort of functional medicine testing. I don't. Um, I'm not really super knowledgeable about herbs and stuff. An herbalist. I didn't do integrative medicine training. I use nutrition, and that means food and, you know, supplements if needed, right? As supplementary, and medicine. Those are my skill sets. Those are the tools that I utilize, and so that's what I'm pretty upfront by that. So if other people want, some people really want all of this different testing. Okay, that's fine. That's not what I do. I can send you someplace else. And again, I'm not, going to also issue like medication, right? Some people will come and say, I really want only natural. I don't want to take any medication whatsoever. That to me also is uncomfortable, because if I feel like there really is a condition that requires treatment, or I really feel like there's something that would be effective, um, then I'm going to, recommend it. And so I just sort of let people know what I'm about from the get go, so that we can hopefully be, aligned to meet their goals, whatever their goals may be.
What a good
Um,
strategy, just overall for all providers, right? I wish more
and for some
conversations
people,
started that
it's
way.
weight. For some people, it's weight reduction. For some people, they don't want to talk about their weight at all, right? And again, my practice is pretty niche focused, because I mostly see people with PCOS, but I do have some patients who don't have PCOS but have some, metabolic health concerns, nutrition. They want sort of help with everything.
Mhm.
And so, if I'm able to, then I will. And so, but people's goals are all over the place. And but I like them to lead with their goals. Like I said, it's not for me to decide.
So what do I'm kind of wanting to get a little bit of what you see too in that metabolic change, because from where I'm sitting now, we're seeing a lot more providers offering body composition testing
Hmm. Yeah,
at that level, and sort of saying, hey, things are changing. This helps us quantify that a little bit in
yeah,
areas where, some things are so subjective and you've got to ask the right, questions to get those answers. This can be a little bit more objective, and I love that
yeah,
we can give a little bit more of a, people who have been so focused on just weight for so long. I love being able to say, listen, it's not just that number. We can look at body fat. We can look at where it is in visceral
yeah.
fat. We really do kind of always sort of come back to talking about muscle health and that piece of it too. So I think that has been a really interesting way that I hadn't thought about, 5 years ago about
Yeah.
where that fit. But now that I'm kind of there age wise and I'm seeing more of this in our customers, it's been a really interesting place for body composition to fit in.
Where I think it's really helpful is especially for people starting out on their journey, who probably, especially based on their history, probably have lost a good deal of lean mass. Maybe they haven't been strength training. And that's a really great place to start, with body composition, because, you know, by and large, if somebody wants to change their body composition, it's really difficult. It's not impossible, but it is difficult to both increase your lean mass and lose your fat mass at the same time. It's not easy. And so oftentimes what I'll ask people to do, and not everybody's willing to do that, is to focus on increasing their lean mass first, and then focus on losing fat mass. And that is a little uncomfortable sometimes for people. So the data can be helpful, because otherwise all people are going to do is see the number on their home scale, and by and large it's going to go up, right? And so that may be really scary and frustrating for people, and that's where body composition testing can help. And so that is one way I feel like that, just gets people thinking in a different way, because everybody wants that. Everybody wants to increase their lean mass while they lose fat mass, right? And it's just our body, just the way our body works and the way our hormones work, that sometimes are like in direct conflict with each other, right? To do that. And bodybuilders know this, right? They have their bulk, right? They're in their bulk phase and
Yep.
then they cut, right? Those are like people who are, builders and doing competitions and such. So they know that. They know that in order to increase, right, their muscle mass, they may also, their weight's going to go up. They may increase their fat mass a little bit, and then they have to shift their strategy to then try and lose that fat mass so they can get that definition, because that's the way our body, that's just the way our body works. We're not, some, and there's variation, right? Some people's, just the way their metabolisms are, as they're bulking up, also accumulate more, more body fat. And oftentimes it's subcutaneous, not visceral fat. We haven't touched on that yet. But that's just, the way their bodies are made, and the way they're, the way when they try to increase their body mass, some fat accumulates as well. And so everybody's a little bit different. So that's where body composition testing can be helpful, because it gives people that data, so they're not like really upset by it, bothered by
Yeah,
it.
or in their head about just making, worst case scenario, or just thinking this is what it's going to be. I think it's nice to be able to give a little bit more data, and there's it, even especially in this age of like people wanting to have testing for everything. um it is funny how often providers just still go by weight for that
Yeah.
whole part of the story.
For that
Right.
whole part of the story, they're still just talking about weight. And it can be, something like, now most of my practice is virtual, right? It's telemed. So I don't have the opportunity for people to come into my office and do body composition testing. Maybe that will change in the future, but there are many different ways, from really quick and dirty, people doing like a waist to hip ratio, to going to their, another office where somebody has a body composition, measurement device, or getting a DEXA scan or whatever. So there are different ways depending on people's resources, and willingness. um, I think waist to hip ratio, I feel like, is something that really I wish more people utilized, as a measurement, because it's so inexpensive and easy, easy to do. um, and when we're talking about, patients with PCOS, or women in perimenopause who are noticing more abdominal fat, visceral fat, that can be a way of sort of measuring that and assessing for that, and that's definitely something that we see. So, yeah. And I
And
think
I think,
knowing what visceral fat and what subcutaneous fat is really important for people, and for people to understand the difference. Yeah.
yeah, I was going to say, how do you talk to your patients about that?
Yeah. So, I mean, by and large, for most, so there are two different like major fat compartments, right? We call them. There's subcutaneous fat, and so that's the fat that you're gonna find underneath your skin. For women, largely it's gonna be on the hips, the thighs, your butt, and maybe it's just sort of all over. Maybe you could have some abdominal subcutaneous fat, but that's that fat underneath the skin that you could pinch, essentially, right? And up to a certain point, it's not terribly problematic for your metabolism. When you get to a certain amount of subcutaneous fat, it does contribute to inflammation, and it contributes to increasing, free fat, circulating free fatty acids, which then can contribute to inflammation and insulin resistance and all of those things. But, by and large, having some subcutaneous fat from a health perspective is not all that terrible. It's when fat is deposited in, in the abdomen and around your organs, in your abdominal cavity, in your chest cavity, that is worrisome. And we call this visceral fats. This is fat accumulation inside the abdomen, not underneath the skin, underneath the abdominal wall, in our omentum and around all of our organs, that tends to be metabolically more harmful. And we do see a shift in women where there is a a change in where fat is distributed, so that it's less subcutaneous, and more visceral fat accumulation. And that has to do with changes in our hormones, where when we are in our reproductive years and our ovaries are capable of producing more estradiol, that actually tends to be protective against visceral fat accumulation. And as that gradually declines through perimenopause and into menopause, then that protective effect goes away. And so that's really what is happening here. And estrogen replacement, one of the hormones that we replace, hormone replacement therapy can mitigate it to a degree, but doesn't reverse it generally, but can mitigate it. And that's it's one of the benefits of replacing estrogen, replacing estradiol. But that's really why it happens. So people can, they're not crazy when they say, I'm doing all the same things, and now all of a sudden I've got this weight around my middle, or my weight is the same, but my pants are tight now. My waist size is larger, even though my weight hasn't changed. And that's real and that's true. And that's why it happens. Gosh, for me, I felt like it was like overnight. I felt like it happened so quickly. And I was like, wow, this is real. This is really wild. And it can be dramatic, and it can be very off-putting for people. It can be really sort of alarming. And then you have to figure out, what do you do? How do you deal with that? What can be done about it? And you hear so many different things. Some people will tell you you can't do anything about it. You can't lose visceral fat. That's not true. You can. And so, but just learning what it is. So I think number one, so people don't feel like they're crazy, like acknowledging that, yes, this is a phenomena that occurs, is a phenomena that's happening to you. How can we, how can we mitigate it, and make the situation better?
Yeah. So what do you then end up, recommending? I'm sure there's a bunch of things. It sounds like
Yeah.
for the right person, maybe getting on estrogen therapy is one of them.
Yeah. By and large, I mean, it's not, I would say that in and of itself is not an indication for people to be on estrogen, traditionally speaking. But if you really ask people, that's generally not the only symptom that they have. And
Mm.
so there usually are other symptoms. And, symptoms of perimenopause and low estrogen can be many, right? That can be hot flashes, night sweats, brain fog, difficulty concentrating, so many, joint pain. That was probably for me the number one,
Mm.
which I think was the most sort of upsetting one for me, because I was waking up feeling like just old, and I was I can't, my body hurts to get out of bed and go to work. And I have a very, when I work in the hospital, it's a very, very physically active job, and I'm an active person, and it was interfering with my level of activity. So for me, that was the most
Hmm.
worrisome, problematic symptom for me, that prompted my wanting to take estrogen, and making shifts in nutrition, right? Changing the way I was, thought I knew what worked for me for a long, long time, and changing that. And so, and playing around, right? You're not going to figure it out all in one, right?
Yeah.
Figuring out
Back
what,
to back to not having one solution that works for everybody,
yeah,
right?
yeah. So figuring out what works. The other thing that we have to think about is that there are health risks that change alongside. So something that I hear a lot of people talk about, they're like, oh, you need protein, protein, protein. And it is true that as we age, we do actually need some more protein, right? We're less good at digesting it. We're less good at incorporating it into our body. And so our protein needs do increase. But what I worry about is, are we consuming so much protein that we're missing out on other nutrients, fiber,
Fiber.
antioxidants, micronutrients, all these things, that we could be missing out on? Because yes, you could eat a lot of protein and they used to think that it was harmful if you ate too much protein, it would harm your kidneys, and that's largely been debunked. If you eat more protein than you will utilize, it'll just get converted into energy. So it'll get converted into glucose or it'll get converted into fat, right? So you can use it as energy. But if it's crowding out some other nutrients that you need, then that is worrisome. And so that's what I worry when I hear people talking about like only protein, right? Most of us are not getting enough fiber. Most of us are not getting enough of many different micronutrients and wanting to make sure that we are including those as well. And then estrogen is cardioprotective. So when we have less estrogen, we're losing that benefit.
Mm,
And if people are doubling down on their protein, they may also be getting more saturated fat if they're not careful. And contrary to popular belief, consuming excess saturated fat does raise your lipids and is not good for your heart, right? So I
mm.
know there's a lot of people out there talking about, like, I was reading the other day about how like butter is like a superfood. I was like, we really lost the like plot on so many things. And so whenever we talk about one nutrient as being so important, we risk losing other nutrition. And that
Yeah.
is what
And
concerns
with
me.
protein, I mean, we just being at this big meeting that we were both at, there's a lot of, companies that come and exhibit there, and there's just this big push to like take the nutrient, the macronutrient, right? Now everyone calls them macros. I'm like, this is
Mhm.
like our science that we learned in school, right? But the macro of protein,
Mhm.
and adding that in its sort of like component form to other foods. So all of these sort of like protein supplemented convenience foods, is that really, that's what can happen, as you said, when a single nutrient is the focus. When
Yeah.
protein only is the focus, you can do all of those things, and that makes it seem like that fits into the dietary pattern. But what we're missing is like protein from the whole food also brings along
Right.
these other things and brings
Right.
along
And
just natural micronutrients that we need from those whole foods. And that's what
iron,
I think we
calcium,
get so
right?
wrong.
Like so many, so many things. So yeah, so when we distill nutrition down into micronutrients, I think we lose a lot. And I'm very much of a food first kind of person. And I always say supplements are supplementary. They're to supplement
Right.
what you're missing, what you're not getting. But like that shouldn't be the way that we are thinking about nutrition, is only in macros.
Right. And bone health too becomes something that, we need to be thinking about at this age too.
Yeah, absolutely. Super important. Bone health. And it's not just vitamin D and calcium. It's vitamin D, it's calcium, it's protein as well. And then it's many, many different like trace micronutrients. But vitamin C is important for collagen production, right? Which is important for the bone matrix. Boron, other vitamin K,
I
right?
haven't
All
heard
these
boron in years.
nutrients.
Boron.
So many. So it's not just calcium and vitamin D, it's all of those micronutrients as well.
Yeah, so it's this interesting time where it challenges a lot of things we think we know about nutrition, about ourselves, about body weight, about, muscle and fat, and it's a really fun time.
I would say, but the good news is, once you go through perimenopause and you're in menopause, if the average age of menopause is 51, and if we're living, and now we, are living well, for another couple of decades, your needs, once you can figure them out, won't change that much.
It's
Barring
a good way.
illness, right? Barring an injury, which may change things. Once you figure it out for your menopausal self, then you can really just lock in, as my kids say, right?
Mm.
And just,
Enjoy.
enjoy, right? Enjoy your health because you've figured it out. So it's worth figuring it out. But the perimenopausal period is It's challenging, it is challenging. And like I said, I was shocked where I was like, I just woke up one day and looked at myself in the mirror and I was like, I don't recognize, I don't recognize my own body. Like, what the heck happened? And it does seem to happen pretty suddenly. So when people say that, I believe them. Um, now that now that I'm through it, I feel like it's good that I figured it out. I don't know.
It's funny
So,
too, just thinking about age. I have a 11-year-old, and so it's like I guess maybe by design, right? Like they're going through adolescence and puberty. If you have kids around
yeah.
kind of the same time, so it's
Hmm.
funny how often we would talk to or hopefully we're talking to our kids about how they should, you know, love their body the way it is, and know that it's changing, and kind of appreciate that this
Yeah.
is what we go through. But then we're kind of maybe at simultaneous times going through this, and a lot of times not being so gentle and kind that we would tell our kids to be, right?
Right. If we're not gentle and kind to ourselves and our kids see that, right, that's not great. And so, being gentle and kind to yourself as you go through a change is so powerful because you're really demonstrating that to your kids. I have boys, but even then they still have their own stuff that they go through, and they're
Yeah.
changing, and I try, just not even to really comment on their bodies. And so, yeah, or just like being sort of neutral about it. So I think that's really important. But yeah, our kids really see what we're going through and they hear it.
They
And
do.
yeah.
And it's also just, to me, I'm really a big language and words and communication person. Like this is always important to me because especially now being around other people in this age where they're just, where you really see it come apparent how much we do judgment on ourselves, on others, and a lot of that is in this area where we're expecting the midsection to stay small. And then, as you kind of mentioned earlier, just I like the way you put it when you're talking about, is it a, do we stay the same? Does this, is it bothersome, or is it related to health? And I think that's always hard to figure out, right? Like what is normal and okay because this is what's happening, and what is something that like we should be taking action on because it has to do with health risk. And if that's a primary focus for us, um, how do we make that a focus without becoming too obsessed with
Mhm.
weight and shape and all of that too?
Yeah. And that's where having a good set of clinicians that you can work with is really important. Having people that you can trust and assessing your health risks, right? There is a role for testing if we're talking about screening and assessing health risks, if we're talking about assessing metabolic health risk. And so it's, looking at your lipids, looking at your family history. Do we need to be doing some extra lipids, right? Do you need these, should we be looking at an ApoB and an LP little a, and you know, do you have a family history of osteoporosis? Do we need to be doing earlier bone density screening? And so being, a bit more selective based on history, what we know about people's history, and their own personal health risks, I think is really important. So there is that balance to be had, right? But it's, again, it's personalized. It's not it's not blanket, and it's not just sort of pan testing everything also. So just being a little bit more, discerning. Um,
And again, I love the message of not just the not one size fits all. I mean, I've been seeing a lot of, like you said, GLP-1s for everyone, hormone replacement for everyone. We're not targeting hormone replacement to lose weight necessarily, and I think that those are important messages that we take,
yeah,
and stay critical and curious and all of that as well.
yeah.
Do
And
you,
I think honestly, it starts earlier, right? If we really want to think about this, like preparing people, like as we talk about, we prepare our kids for puberty, but then we sort of stop anticipatory guidance,
mm,
right? That's what the pediatricians call it, right? They counsel parents when they see them on what to expect in this next stage. called anticipatory guidance. And somehow we reach adulthood and that stops. And I feel like it shouldn't, right? What should we expect in this next phase, right, that we're going through? I think that would be really, really helpful. So then we can think about how to like being ahead of things, prevention, etc.
Yeah,
So I
and
love,
like you said, laying down, when we can talk about muscle mass or lean mass and how can we lay that down. I mean, that
yeah,
takes a while to build, right? And if that starts declining in our 30s and we're
yeah,
not yet really talking about the other, kind of menopause transition until maybe 40s, there's some time there that could be part of the conversation before they
yeah,
end up in someone like your office, right?
right, absolutely. And so talking at it at each different life stage, right? Talking because it's harder with age to bounce back. Remember back from when, I mean, I don't know if you were an athlete, but if you injured yourself, in your teens or your 20s, you would, you'd rest and then you'd come back at it and you'd be at that same level of fitness or strength like within a couple of weeks. Now, in midlife, the atrophy happens so much more quickly, and to recover from that takes so much longer. And so that's not something that we really think about and talk about, right? So that's certainly not something that when I was in my OB practice necessarily I spoke to moms about, in their postpartum recovery, right?
Right.
Every
Start lifting
pregnancy.
weights.
But for real, for some people, like if you had a C-section and you've recovered from major abdominal surgery, the impact that that's having on your lean body mass, we don't think about it, right? And if you've had multiple surgeries, did you have, did you injure yourself? Did you have an orthopedic surgery? Then we talk about it because we're recovering the joint. But if somebody has an
True.
illness, right? And so we're not talking about this because if we were, then we can actually be a bit more proactive.
That's good.
And so I think, just the conversations around body composition are important. And body composition testing can be part of that because it gives people that information. So like if that could be more accessible to people. And so that is one thing. Like if I were to just go back, I would be wanting to address these things really just from,
Earlier.
with my patients in their 20s,
Mm. Yeah.
right?
Well,
If
I
you
was more
don't,
mathlete than athlete, but I do get I do I do get that for sure. And I think, I really like the way you've been talking about sort of life stages versus, just this one that we're going to focus on. And, and that's important for everybody. And in primary care and all the different kind of places where you have conversations with healthcare providers, I think these conversations should be known and expected, not this time of like, what are these symptoms? Something's wrong with me, and how do I fix it? It should be much more like, oh, yeah, they said this was coming, and now this is what it looks like. It could be different for everybody, but here's some things, and here's how I know how to, what needs attention and what needs help, and what do I just have to have acceptance for and get through so that I can enjoy the post menopause golden
right.
years, it sounds like.
Yeah. Right. To just get through that rough patch because and you can be a bit more proactive. Right. And so I think that's really helpful. And I'm glad we're having the conversations, but I want to make sure that they're the right conversations, and not, just these opportunities for, people to take advantage of. Um,
I'm with you on that for sure.
yeah. And I think it's also important, community is important. Um, getting together with your girlfriends, talking about these things, facilitating these conversations is really important. And it doesn't just have to be from the professionals.
Mm.
There's so much that can be learned from your peers, and especially if you have peers that have sort of gone through things already, that can be really helpful. There's so much wisdom that can be gained just from talking to each other. It doesn't have to be one directional learning. There's so much that I learn when I get together with other women who aren't professionals, because I learn what other people's experiences are, not just my own experience. And that helps me to help other people, and I think that's really important. So having these groups of women, and it's not just those of us up here talking down to everybody else.
I love that.
Really learning from each other. I think that's really powerful.
Totally. Well, are there places, that you recommend, or professional societies, or are there people who you're like, these are places for folks to go for really good quality, I don't know if I'd say advice, or information or connection, or also just how do we stay connected with you as we wrap up?
Yeah. I mean, you can stay connected with me by so many different ways. You can follow me, on different social media platforms. I'm on LinkedIn. I'm on Instagram. I just started a YouTube channel, so trying to grow my YouTube channel, so you can follow me there.
Okay, we'll put the links
You
there
can
for
find me,
sure.
yeah. um but just talk to your friends. Like, it doesn't even have to be where you look. There are different online platforms. So if you are looking truly for like a like a menopause focused online platform, like Electra Health is a great one. I'm not affiliated with them, but I've sort of you know I'm a member of their forum. But just it, get together with some people. I've done like private like facilitated group discussions with um with companies, with corporations who've
Mm,
decided they want to facilitate discussions amongst their women employees.
I
So if you are someplace where you have the ability to get a group of people together and you want information from an expert, you can do that too, right? Just reach out and find somebody who can come and talk to your group, and just also talk amongst yourselves. Um, I'm involved in this wonderful, wonderful retreat that is for women in midlife, and you just went on a retreat as well. So this is a new sort of, and there was just a friend of mine just sent me um the link. I haven't read the article yet, but Condé Nast had a recent article about women's retreats. It's the new thing for women in different life stages, and how great that is. I know I have a great experience leading the retreat. I think it's really an incredible experience for the people that are participants, but I learn as well. Even though I'm putting so much energy and heart into it, I get a lot out of it as well. That sisterhood. But even if you
mm.
can't go away for a week to some fabulous location, if that's not within your means, you can just do something for a few hours, or for a day, and just facilitate the conversations. Just open,
That's great.
just, yeah. People
Yeah.
want to share. Just oftentimes they are not always comfortable. So
Yeah, I think that's great. And even just learning, I think that sort of like what's next, and hearing from people who've gone through that. I've experienced that even in, friend groups where some of the, on the younger side, like, oh, that's coming. We gotta, start paying attention to that. And then hearing people who are on the other side, I think, just the even cross-generational groups are important in that way too. So there's a lot we can learn
yeah,
from our family and from our, friends at that level. So, well, what a
absolutely.
great conversation that crossed lots of realms. I really learned a lot, and thank you so much for your approach. I really feel aligned with the way that you practice. So I really appreciate that, and I'm glad to be able to share that with our
Thank
listeners.
you.
And I will leave all the links to the places, so we'll make sure that people can stay connected with you for more information, and maybe jump into one of those retreats sometime as well.
Yeah. So thank you. That really means a lot, coming from you, for you to say that. So thank you very much. Always, I admire your work and love your podcast. So I'm really glad to be able to, to join you and be a guest. And yeah, and just reach
Thank
out
you.
if somebody wants to, like I said, you can always reach out to me. I'm pretty responsive. So
Great. Well, thank you so much for your time. I really appreciate this conversation, and see you at the next event, maybe. All
okay.
right. Bye.
Bye.